Hi, my name is Anna Burness, and today I am checking off Ashland on NG tube insertion and Foley catheter insertion. Today is January 6th. It is 1:50 in the afternoon. I'm going to read the scenario and then I'll start the timer. The scenario is you enter the room of your male patient admitted with an acute embolic cerebrovascular accident. Your patient is at risk for aspiration as a result of the CVA. Place a nasogastric tube to allow for medication administration and enteral feedings. As a result of the CVA, your patient is currently incontinent of urine, and per MD order, place a Foley catheter.
Hi, my name is Ashland Walls. I'm a Liberty nursing student. I'm going to be your nurse for the day. Can I please have you state your name, first and last, and your date of birth? Alright, thank you, Mr. Smith. So today what we're going to be doing is we're going to be putting an NG tube down for you. So the first thing I'm going to be doing, it's a clean procedure, so I'm going to perform hand hygiene and stick on a pair of clean gloves. And then from here, I'm going to have my assistant come and help raise you up in bed to a 90-degree angle. Alright, so what I'm going to do is I'm going to take the tube and I'm going to measure from the tip of your nose to your ear and then down to your xiphoid process. And we're going to mark it with a piece of tape, and this is going to be our reference point when we're inserting the tube. So now what I'm going to do is I'm going to take the end of the tube, I'd stick it in some lubricant, and what I would do is as I insert it into your nose, I would have you drink some water and swallow, and I'm going to have you bend your head forward to your chest, and then I'm going to be inserting it, and I want you to try to swallow, and as you swallow, I'm going to try to bend the tube to closer down your throat, near your bending it towards your ear to help the process go down smoother. And I'm going to go down to the edge of the tape mark, and then I'm going to take my tape. This would be inserted into your stomach, and we place the tape on your nose. Take my gloves off. And then we'd wrap the tape around the tube. Alright, and then to ensure that the placement of the NG tube was in the stomach, the golden rule is to do it with an x-ray, but we wouldn't do it with an x-ray. You could also test it by using a pH test, in which I would take contents, I'd aspirate it from the tube, take the gastric contents and measure them with the pH, making sure that it was acidic, or I could auscultate over your stomach, making sure that I heard a swishing sound. And I also, as I would perform an NG tube, I'd make sure that I would ask you if there was any signs, if you ever had a broken nose or a deviated septum, or ever had a head injury. And that would conclude the NG tube insertion. Alright, so after I did your NG tube, I would perform hand hygiene, and I'd stick on a pair of clean gloves again. And what we're going to be doing is inserting your Foley catheter. So in order to do that, I'm going to raise the bed up to a level that's comfortable for me to work in. What I'm going to do is I'm going to take down your sheet, and normally this would be placed at the foot of the bed. There's not much room here. And then I'm going to take a rag or some wipe or washcloth to clean your thighs and your scrotum and your perineal area. And then if I could have you, Mr. Jones, bend your knees up for me. Alright, so from here, after I'm done cleaning you, I'm going to go ahead and remove my gloves and perform hand hygiene again. And we're going to go ahead and place the sterile field. Using the 1-inch margin rule. Alright, and if it's okay with you, Mr. Jones, I'm going to use your chest to put on my gloves. from here I can go ahead and fix my gloves. Now that both my hands are sterile. Alright, Mr. Jones, so now I'm going to start the process of inserting your catheter. I'm going to go over here. My hands are sterile, so I can go ahead and pick up the sterile field with my hands. Making sure that this does not touch anything. I'm going to go ahead and I'm going to insert this under your legs. Making sure that I do not touch your legs or any other thing. And if I was, I would have to take the sterile kit and redo the whole procedure of making a sterile field. So the next thing I'm going to do is I'm going to undo my sterile field a little bit here. And what I'm going to do first is I'm going to take out the lubricant and I'm going to squirt it out into the container and take my swabs out.
Watch your border.
Alright, and I would dispose of this in a trash can that would be near me. And then I'm going to go ahead and take out the catheter itself. What we're going to start by doing is I'm going to take the end of the catheter and lubricate it. After I go ahead, I'm going to take my syringe. I'm going to place it. We're going to test to make sure that the catheter is working, that the balloon is. So what I'm going to do is I'm going to insert it roughly with 10 cc's of solution, make sure that the balloon does indeed work, and then we will take the syringe out, go ahead and place the tip of it in lubricant. And now what I'm going to go ahead and do, I'll place this back in here, and then I'm going to go ahead and clean you up. So this hand is no longer going to be sterile. I'm going to go ahead and grab it with my left hand because I'm right-handed, so I'm at the right side of the bed, and my left hand is my non-dominant hand. With my dominant hand, I'm going to go ahead and take the first swab, clean in a circular motion on the inside of the penis, and go ahead and dispose of this in the trash can. The next swab, I'm going to go ahead in a circular motion, clean the outside just a little further out, and dispose of that one as well. And then last, we're going to do one more time further around. Alright, and dispose of this one as well. Now from here, we're going to be ready to go ahead and insert the catheter. So Mr. Jones, you're going to feel a little bit of discomfort and slight pressure, just so you know, so don't be alarmed. Alright, so from here I'm going to go ahead and insert the catheter until I begin to see urine build up into the tube. After I see urine start to fill into the tube, I'm going to place the catheter in about another 1 to 2 inches. And then from here I'm going to go ahead and insert the solution to blow up the balloon. So we'd insert the solution, about 10 cc's. And then from here I'm going to go ahead, tug on the catheter, make sure that it's inserted properly. And then I can go ahead and remove the syringe. And then I can take the catheter bag. I'd take it, the edge of it with a little bit of lag, place it on his stat lock on his thigh just to ensure that there's a little bit of lag so it doesn't get removed by tugging or anything. And then the actual bag would be placed on the bed, not the bed rail, hanging below the bladder. And what I'm going to be doing after this is checking the contents of the bag, looking at the urine to check for the color, the consistency, and the odor. And
How will you secure the Foley?
You mean how I secure it?
Just in a mail, you just you pull up the penis and you just tape the tube of the Foley upward just so it doesn't tug out.
Okay.
That's okay. You did everything else perfect, so great job.
Thanks.